Good morning. Thank you, sir. Topic is phaco fluidics and phacodynamics. And what is the
Kiranjit,
new,
please come on the dash.
what is the new in phaco fluidics and phacodynamics? Here I wanted to mention one important point is that these two terminologies are basics. As you do more and more, as you become more and more experienced, you learn something different and that is advanced. This is my message. Pointer, I guess. Pointer, eh? Sir. Another definition of the phacofluidics and phacodynamics is phacofluidics is the current of water fluid in the eye. Yes, sir. Thank you. And the phacodynamics, your correlation of this energy, vacuum and flow rate which is there. This is the basic video of 15 years before. With the video overlay, you can see the compact machine. This is the trench where this is top and chop technique. Energy, if you can see here, is the most important part, not vacuum and flow rate. So energy is important, you can assess. Now second is the hold. When you hold, your vacuum built up. At that time, aspiration is cut off. So vacuum is important to build, to hold, and to maintain the hold. And then third step is removal of pieces. If you see here carefully in these waves, all the three are working together. So you need energy, you need vacuum, you need flow rate. Very important thing is that I was doing one of the live surgery in Jordan. I was not holding the mass. Suddenly that Alcon engineer has increased the vacuum suddenly. So it is not the vacuum and flow rate both. Not like that. Vacuum will bring, flow rate will bring the tissue towards you. Vacuum will hold, vacuum will maintain. These are very important and simple things with every machine. There is no need of any hi-fi machine for that. So all the three is working together when you are removing the pieces. This is very important. Again, the second piece, if you see that, see the vacuum reached to certain level. In those days, I was using 150 vacuum to do this case. And at that time, flow rate will cut off. Flow rate has bring the piece, vacuum build, flow rate will go to zero. This is a peristaltic pump where these two parameters work together, assist together. But this is the correlation. Why I have told what is the advancement? You don't understand this when you start the phaco. After 5 to 10 years, you will understand the clarity is there, and that is the advancement. Now, hold, you can chop, and again the same thing. You have to be in the center to do the best, all these things together. So this is the phacodynamics. Every machine will work on this principle. This is another very classical teaching figure in my training program. After 2-3 days, doctors started doing something. But if I will not show this picture, not show this video to them, 4th day they may rupture, 5th day they may rupture, because this is very important for them. Now the two instruments are working together. It is not just flow rate and vacuum. Now because of this side port, there is the leakage and you can see the pieces get stuck here. So this is the diversion of your fluid current. And so flow rate will not work. You remove that chopper out, all the pieces will come towards phaco tip. And whatever flow rate you have kept will work 100%. So this is very important. The flow rate, too many pieces, too many instrumentation, too many incisions will cut off the flow rate. If only phaco tip is in the center or in the eye, it will work perfectly. So that Flow rate is depend on instrumentation, not what you have, not coming piece, you can increase 30, 36, 40. It is not correct practice. So one phaco tip, remove the pieces. Now, this is another slide which I understand after 10 to 12 years of my phaco practice. Now one phaco handpiece is inside. Pieces are not coming clearly. There is a struggling. Can anybody tell that why the pieces are not coming easily? Why? Because this is the base of the phaco fluidics. Can anyone? Yes. One point is the occlusion. Second. Yes, sir? Okay. No, normal case. So this is very important. Now one phaco tip is crossing the center. It is beyond the center here. If the phaco tip is here, the current of water fluid is only this much. When it go in the center, it will increase little bit better. So it is not required any top-end machine. It's any simple phaco machine. If your phaco tip is in the periphery, phaco fluidics will be less. If it will come in the center, it will be better. And then if you keep your phaco tip here, current will assist the flow rate and vacuum. And your phacodynamics will be better. So already I mentioned this is the advancement. This is not advancement. This you observed, you understand after 10 to 15 years of practice. So please see this video. It's struggling. And you come back and how the same parameter, same machine will work. This is because of the very nice current of the water flow. After that, now another very important aspect is now you can see the eyeball position. Because we are not, many times we are doing phaco surgery, eyeball is tilting down way, up way, side way and all that. Here if you see the position of your eye, it's a horizontal position, your current of water flow will be better. If this position is the primary position, what we can say, little bit tilt like this, it disturbs your water current. It disturbs your phaco fluidics. This is the very, very important, because what will happen when you try to remove the pieces, position is not correct, unnecessarily you blame the machine. New people. You may increase vacuum, increase flow rate. आज phaco अच्छा नहीं चल रहा, आज tubing अच्छी नहीं है. I would have used the new tubing. But the point is that it's your primary position which is responsible for the fantastic phaco fluidics, phacodynamics, water current. Now here see the eyeball, once it takes in horizontal position, that pieces which stuck at 12 o'clock, they are coming nicely in the center. So this is what I wanted to mention and emphasize. And that is the reason many times I can take, if it is a not difficult situation, I take superior and inferior rectors even. At least in my teaching, every case I take 2 rectors so that I try to maintain the position of the eyeball in a better way. Even, not only in a phaco, in when you are doing the irrigation aspiration also, this primary position is very, very important. Because just now Rohit sir has mentioned about the floppy iris. Normal iris, we turn out to be floppy because of this position. Iris, you can see this. Suddenly the iris came like this. If you can think on this slide, there are many points. Doctor come out suddenly out. position of the eyeball was not horizontal. So one slide will give you the lot of information if you watch. Even in my training program, I record the external hand movements of the doctor. So external hand movements will give the very good idea that exactly what speed he has come out, how he is coming out. He is coming out straight or giving the shape, planning parallel to iris and come out. So this picture, and then I realized you can manage the iris. And you can see the position was throughout the patient was like this. So this position will be simple like this. That will also assist your phacofluidics and phacodynamics. So I always tell that a simple basic points in a better way, if you understand, that is advanced phaco. So this is the advancement in the phacofluidics and phacodynamics. Thank you for your patience.